again, my name is Michael Guthrie, and yeah, I've been working here just a little over a year now as one of the physiatrists or PM&R physicians. I work at a Dodd Hall and Martha Morehouse outpatient clinic, seeing primarily patients with traumatic and other acquired forms of brain injury. I did training in physical medicine and rehabilitation, and then a specialized training in brain injury medicine. Um, so, kind of learning all of the medical complications and treatments of this patient population. And so, yeah, the goal of this talk today is just to give an overview of some of the like medical definitions and sort of basic symptomatology of this population. And hopefully it leads into good discussion and questions that, we can talk as a group, because I know there's kind of a broad array of perspectives and different expertise. And so hopefully this kind of kickstarts things in a good way. So what is a traumatic brain injury? So just the definition, textbook definition being an alteration in brain function or other evidence of brain pathology caused by an external force. Of course, the traumatic referring to that external force, the fact that there was some sort of like force delivered to the head or neck area that then led to this altered neurologic functioning. But it's obviously important to note that there are non-traumatic brain injuries. For example, lack of oxygen to the brain is known as an anoxic brain injury. And these injuries can occur together in isolation, to varying degrees. So it becomes very, kind of unique to each patient very quickly. So in general, any type of brain injury is characterized by the specific anatomy of the brain that is involved, as well as the severity of the injury. And there's certain typical patterns that we see with different types of injuries, but also a wide variety of different ways this can present. And so I had some images here. So this is a CT scan demonstrating an acute subdural hematoma. That's on the right side of the patient, the left side of the skull there. You see that brighter kind of appearing texture, and that's all blood and bleeding on the brain, compressing it and pushing it against the skull and in the other direction. And so that is a typical pattern of brain bleed that's seen from a trauma that affects that side of the head. This could be from a fall or a motor vehicle collision. Now, this other image is a MRI scan demonstrating areas of ischemia due to an anoxic brain injury. So, for example, somebody having a lack of blood flow for a number of reasons could then actually have some pretty profound stroke, like areas of the brain that are affected by this lack of blood flow, and then subsequent damage to those areas of the brain. And so here it's involving some of the subcortical structures like the basal ganglia, which coordinates movement in the body, as well as the posterior area of the brain. At the bottom of the screen there is sort of brighter, and that's the occipital lobe, which is responsible for visual, can lead to visual impairments in an injury like this. So to talk about severity of brain injuries, we usually reference something called the Glasgow Coma Scale, which is a measure of neurological functioning. The so-called mild injuries may only involve just a brief loss of consciousness, along with other common symptoms being dizziness, confusion, and headaches that may last for just a short period of time compared to more severe injuries. There's also terminology that notes a mild complicated TBI involving a skull fracture or intracranial bleeding, basically anything that you can see on a radiologic scan in conjunction with the trauma, even if it scores as mild by other measures, would then be referred to as a mild complicated traumatic brain injury. And this helps us stratify maybe from, just more mild concussions to potentially more higher severity based on these imaging findings. And then finally, moderate and severe injuries as measured by the Glasgow Coma Scale as one measure of severity would indicate more significant impairments with things like ability to spontaneously open your eyes, communicate, or perform movements on command. These severity of injuries typically lead to more of a prolonged loss of consciousness and amnesia, or inability to form memories moving forward. And so this is a graphic that kind of helps break down the differences between these three responses: eye-opening, verbal responses, and motor responses, and then how the scoring will then actually impact the initial severity of the injury. And this is all from the very initial measurements that are done, in that first 24-hour period when patients are presenting. So a word about repetitive head trauma, as I know it's pertinent to our patient population. It can lead to a number of sort of complications on top of just the singular trauma. And so it's well documented in literature that those with multiple concussions or multiple head traumas have a much higher risk of prolonged post-concussive symptoms. There's also a concept of an even more severe syndrome that occurs, primarily documented in case reports in athletes, but presumably could affect anybody with two brain injuries in short succession. And this is a severe syndrome of diffuse brain swelling or cerebral edema, as well as herniation, which is brain kind of pushing through different hard areas of the skull, that potentially is following two only more minor traumas, but that happen in close succession. So for example, if an individual had a concussion, was not completely recovered from that initial concussion, and then they went on to have another seemingly mild traumatic brain injury, could subsequently develop this second impact syndrome, which would be a sort of catastrophic outcome. And then finally, there's ongoing emergence of understanding about this condition called chronic traumatic encephalopathy, and it's a very complicated and like I said, newly discovered topic within the recent decades. But in general, this involves a syndrome of neurodegeneration, so an actually progressive declining neurologic status involving abnormal protein deposition in brain tissue. And it's thought to affect these at-risk populations, including high-level athletes and military personnel that are exposed to a very high degree, potentially on the dozens or 100s. Oops. There we go. Dozens or hundreds of injuries over time. So what symptoms develop after brain injury? This is sort of a complicated question to ask, because if you've seen one brain injury, you've only seen one brain injury. That's a quote that somebody that mentored me in my training told me, that these are not cookie cutter injuries. They're not stereotypical. One individual's experience of a brain injury may be vastly different from another's. And so it's important to understand that each survivor's experience of a traumatic brain injury could be very unique based on both the specific areas of their brain that are damaged from the trauma, as well as pre-existing patient factors that may predispose them to certain conditions after their injury. So there are some typical patterns that we frequently see in brain injury. But just like for some examples, like a high school student who has ADHD and difficulties with hyperactivity and attention, who then gets a brain injury, may especially struggle with cognitive impairments in that attention, as well as more motor restlessness after their brain injury, compared to another individual who didn't have that premorbid diagnosis of ADHD, may not have as significant impairments. And then another example would be like an individual with prior substance use or issues with impulse control is definitely going to have worsening impulsivity and potentially even full out agitated behavior after a brain injury. So some other specific cognitive and behavioral symptoms that are common to develop, we talk about agitation, and this can really range from anywhere from mild restless movements and anxiety all the way to verbal and physical aggression towards the patient themselves or others around them, and is typically involved with a lot of confusion, and sort of best served by reorienting the patient and trying to avoid whatever triggers may have brought on that sort of behavior. There's also, on the other end of things, a post-traumatic depression that can very frequently develop, where those that have had a brain injury develop very low mood, poor energy levels, issues with sleep, and problems with lack of motivation. That is sort of like a negative symptom after brain injury that can develop of this lack of behavior. There's also the concept of cognitive fatigue, which is sort of difficult to define discretely, but in general involves a slowed processing speed or a difficulty to sustain tasks over time. Whereas an individual may have been able to work an 8-hour day, they may now only be able to pay attention to task for 1 to 2 hours of the entire day before leading to severe fatigue. It certainly can fluctuate and is influenced by other factors like sleep and medications that patients are taking. And then finally, one other discrete symptom that's fairly common is something impaired executive functioning, where some individuals may actually do pretty well with basic attention and memory tasks. However, when they're asked to do more advanced things like organization, highly logical processes and complicated matters involving high-level decision-making and judgments, their cognition may really struggle. And this may be frustrating or difficult to define without some specific testing to suggest that this sort of thing is occurring. So in general, when you've identified a brain injury and these subsequent symptoms, the immediate treatment is sort of emergent. It's emergently focused on reducing swelling and inflammation associated with that brain injury. So there's that primary trauma, and then we know that the brain swells, and then there's a cascade of impaired metabolism in the brain. And so it's really important to seek immediate treatment to make sure that those things are well controlled and this brain injury doesn't expand and further grow into a worse problem. As that inflammation sort of calms down in the days to weeks after a brain injury, and then it's recommended for individuals to get established with a form of physical rehabilitation for their brain injury. This is most commonly performed under the supervision of a multidisciplinary team, including, but not just limited to, but some core members, including a physician, different types of therapy providers, as well as psychologists. Physicians may prescribe specific treatments and medicines, especially to help with sleep early on, as well as pain control of headaches. And then if there are prolonging issues in cognition or mood regulation, there's plenty of other medication options that can be entertained under the supervision of a physician familiar with brain injury medicine. The overall symptoms of a brain injury usually are most severe in the initial days to weeks, and then it gradually improves over time. Although, of course, depending on other patient and external factors, different individuals can experience different duration of symptoms and chronicity. And of course, things can develop like that post-traumatic depression or issues with return to work or cognition can sort of fester and develop worsening over time. So this is sort of a big picture map and overview of the overall treatment care flow of brain injury. So, initially starting in that emergency evaluation in the emergency department, potentially needing to go to the ICU to get like immediate trauma care, and then going to inpatient rehabilitation facilities. There is sort of a pathway where the initial trauma is seen in the emergency department, and then you can sort of skip to the home setting if the patient is stable and with not as many complications, and then they will go immediately home and start outpatient therapies shortly thereafter their initial injury. Regardless of exactly which pathway individuals go, I would just advocate that it's important for individuals who have experienced one or more brain injuries to be established with that sort of point person provider, whether it's a primary care doctor or a physical medicine and rehab more brain injury medicine focused provider that can direct the care from there and make sure that we're getting these different levels of care and these different levels of therapies involved, and whether that involves inpatient admission or outpatient therapies, and with the ultimate goal of supporting that independent living and supported program for individuals in the long term, as well as even beyond that, return to work and vocational services. So barriers to care after a brain injury, some clear ones involve just that lack of early intervention, no rehabilitation, and the lack of treatment of those comorbidities, attention issues being left untreated, or mood disorders. So this lack of engaging patients in somewhere in this treatment map is definitely a large barrier to care and can prolong symptoms and worsen outcomes. A lack of a strong family support system or no long-term supervision, or just the lack of a supportive environment at home is linked to issues with ongoing success of brain injured survivors. So definitely needs a lot of support from their family just to help reorient and redirect, especially in cases where the executive functioning is impaired, help with financial decision making and return to work decisions, and just how to sort of plan out your day. It's crucial to have that family support and caregivers at home, and lack of that is a major barrier. And then, of course, well documented, especially in some good studies in the groups here at Ohio State, has been substance use being a major barrier to ongoing symptom recovery and just recurrent problems with brain injury. It's, of course, a risk factor for brain injury to be involved with substance use, if not just prolonging the symptoms from a premorbid injury. So to summarize here, brain injuries can occur from any insult to the brain, whether it's traumatic or anoxic. There's a variety of severities and types of symptoms that may develop. And this depends on the specific injury and the individual. It's really important to see a medical provider early on after a brain injury to help get that proper rehabilitation. And this involves a multidisciplinary team of providers, including doctors, psychologists, physical occupational speech therapists, as well as engaging family members in the treatment plan. And that lack of support system or substance use are key factors that need to be identified to help prevent negative outcomes after a brain injury.